Call this meeting in order for the April 27th, 2023 Board of Trustees meeting here in Hillsborough, Missouri. Before I begin, I do have some comments and statements I want to make. For those who've never been in a board meeting with me, I run a fairly tight ship. Good conversation, but I want everybody to know that I started on time and we're going to roll through this expediently as possible. For everybody who's listening and watching forward, there's a table tent here in front of me, which has our communications email. So if you need to make comments, want to send us stuff, inquiries, whichever you need to do, it's communications@jeffcohealth.org. That is the email that you'll need to use. It's also on our website. These emails are going to be used for all of our business at the health center. It comes to the organization, to the email server for proper documentation and storage. This is for future sunshine rules and laws as is required by law. There's also a sunshine request email, which is different. That email, I apologize, it's not here, but that email is cor@jeffcohealth.org. That can also be found on our website. So for any sunshine request, that is what you should use. If you make a sunshine request, and I'm going to step out of my water a little bit real quick, to the communications Jeffco Health, do we send it back to them and tell them to go do it correctly, or what do we do with that?
I let them know that it's been forwarded to the custodian of records and in the
Thank you.
future to use.
So it will get forwarded to their, thank you for that, Ms. Weiner. All right, next part of my opening statement. Robert Rules of Orders would be adhered to for all official health center meetings. The quorum is of the utmost urgency. I'm going to go through this. I know some people are going to shake their heads and go, yeah, okay, but this is, I'm going to do it. So the chair is the chair and shall be recognized as such. Trustees are trustees and shall be recognized as such. The director is the director and shall be recognized as such. The counselor attorney is the counselor attorney and shall be recognized as such. All other persons shall be recognized respectfully as the individual so chooses. We shall comport ourselves as trustees and adults as we are expected. Our words, actions, and civility shall be on display to set an example for ourselves, our community, and most importantly, our youth. Robert Rules of Orders are clear on how a trustee should comport themselves. All statements, questions, and comments in the meeting shall be directed to the chair. No one is to direct their comments to anyone other than the chair. Doing otherwise is out of order. That is all I have at this time. Ms. Pinkley, would you be so kind as to do roll call?
Mr. Pig,
I am here.
Mr. Deal,
Here.
Ms. Stidham,
Here.
Dr. Henry,
Here.
and Ms. Davis.
Here.
A quorum has been established.
Yes.
Thank you. All right, first, the next item on the agenda is reading of the mission, vision, and purpose. Mr. Deal, would you be so kind? Trustee Deal.
Yes, I would. Mission is Jefferson County Health Department will champion positive health outcomes and behaviors through innovative programs and community engagement. Vision is advancing the health and safety of Jefferson County. The purpose of the health center, as established in Missouri
Revised statutes.
revised statutes, thank you. 250.050. Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you, trustee. All right, the next on the agenda is approval of the agenda. I know I think there's one amendment.
Mr. Chairman, I'd like to make an amendment to have a closed session directly after the director's report.
And first, do I have a second?
I'll second.
First and second, is there any discussion?
Mr. Chair,
Yes,
you
ma'am.
need to announce that the closed session is pertaining to,
Personnel matter.
yes, correct.
Is there any other discussion on the change of, onto the amendment? Okay, hearing none, all in favor of the amendment, please say aye.
Aye.
Any opposed? Motion carries. Now I need approval of the is there any other amendments? I'm sorry, I apologize. Now I need a motion to approve the amended agenda.
So moved.
A second.
First and second, is there any discussion on the agenda amended? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. We have at least 3 guests in the room. Would you, Mr. Giannicola, would you like to introduce yourself, sir?
Sure, my name is John Giancola, and I'm just I'm the liaison for Senator Coleman. And I'm also the committee man in Big River Township. I'm just here observing.
Thank you. Welcome. Ma'am.
Hi, I am Alicia Embry. I've attended several times. I provided witness to a recent meeting that I believe is related to your closed session amendment. And I would encourage you to ask me my witness testimony related to that item. If you choose not to, that's obvious. Here is a county resident. And I have been participating as such for months.
Okay. Yes, sir.
My name is Chris Borgerson. I'm live in rural Festus, a place called Ampleville. I'm interested in county government, and I'm also a graduate student completing a Master of Arts degree in counseling. So I'm also interested in mental health issues and ever having.
Sorry, I couldn't hear that. I'm sorry.
What? Start over?
About you're in a educational program?
No, I'm a graduate student at Missouri Baptist University.
Okay.
And I'm taking my last class for a Master of Arts in Counseling. So one of my interests is mental health in the community. I've never been to one of these meetings. I'm just curious to attend and see what's going on.
Very good. Ma'am, would you like to introduce yourself?
Yeah, Teresa Merrill, High Ridge, Missouri, just an interested Jefferson County citizen.
Okay, thank you.
Liz Downer, High Ridge, Missouri.
Well, listen, thank you. Thank you and welcome all. Okay, our next thing is recognition of Mr. Prater. Mr. Weiner, would you like to, Mr. Prater couldn't make it today, I apologize. He had other business that he needed to attend to. Ms. Weiner has a plaque that she'll read. If you'd be so kind, please.
You betcha. Hoping this camera catches me. So this is our certificate of appreciation proudly presented to James Prater in grateful appreciation for your outstanding dedicated service to Jefferson County Health Department and the citizens of Jefferson County, Missouri from April 2019 through April 2023. And then our board president has signed that one.
Anybody's ever served in the capacity as an elected official, they understand the depth of what it takes to do so. All right, we're going to move on. Approval of minutes and expenditures. I need someone to give me a motion to approve the March 29th, 2023 meeting minutes. Everybody was here but Ms. Stedman.
So moved.
First,
I'll second.
have a second. Is there any discussion? Not hearing any. All in favor? Aye.
Aye.
Any opposed? And we'll have one abstention, right? You need it.
I understand.
There, thank you. You did it all on the board. Okay. The next is approval of the April 11th, 2023 meeting. Everybody was attendance.
I make the motion to approve.
I have a second.
Second.
Thank
I'll
you.
second that.
We have a second already over here with Ms. Stedman. Thank you. Is there any discussion on this point? Not hearing any. All in favor, please say aye.
Aye.
Any against? Motion carries. Come to the approval of the March 2023 expenditures for an amount of $272,125.04. I need a motion, please.
I move to approve the March expenditures in the amount given.
I have a first,
Second.
and a second. Any discussion on the matter?
Mr. Chairman.
Trustee Davis.
Okay,
just like to point out, again, I understand, there's an Aspen program, but we're using a subcontractor called Architect now, setting up the platform. And we've spent another 38,922 and up to date. That brings us up to close to 800,000 for the Aspen program since June of last year. And then the next thing would be our legal expenses. Still seem to be over 100% of what they were in 2020. We had a yearly budget of about 12,500. And now we're spending over that in 1 month's time. So this month we're looking at about close to $18,000 all added together for the month between February and the end of March. I just want that on record.
Thank you. Any other comments from anybody else? Okay, not hearing any. All in favor of approving the expenditures? Please say aye. Aye. Any opposed? Motion carries. Approval of the March 2023 electronic payments for $476,570.83. I need a motion, please.
I make a motion.
Have a first,
A second.
have a first and second. Any discussion on the matter? Not hearing any. All in favor of the approval, please say aye. Aye. Any opposed? Motion carries. Come to the pre-approval of the May 2023 electronic payments for $586,682.27. Need a motion?
Make a motion to pay for the pre-approval of the May electronic payments.
Now, second, please.
A second.
Thank you. Having first, second, is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. That brings us to the Director Support, Director Ballmer. I'm sorry. Wrong side.
Will be Melissa Farley, who will be presenting the clinical services report.
Thank you.
Good afternoon. In your packet, you should have our clinical services report for March data. I'm going to point out just a couple highlights. Our Title 10 program, our staff are working very hard on a new data reporting system that will go to the Missouri Family Health Council on a monthly basis. It's required by contract, and there's a lot more data points required now to be reported on a regular monthly basis. So we've been working very hard to get that together. The other thing I will highlight is our community clinics in March. Our testing community team attended a couple of events in March, the Senior Expo and Festus, and the Soil and Water event on Saturday, March 25th. And we provided health screenings and vaccinations at those events. The data report that you have in your packet, I believe most of you heard that our dashboard is still being revised. We had an update. So this was pulled directly from QRMD, but is not representative of what the dashboard will look like going forward. So the first page is our mobile wellness dashboard that shows by month the number of appointments and the appointment type. So you can see for our mobile wellness program, we're seeing things like labs, physicals, sick visits, new patients, well visits, blood pressure checks.
Ms. Farley, I apologize for interrupting. It didn't copy well on the packets for the board members. Would you mind just for the appointment numbers for that month to just go
Sure.
through those?
Yeah, so this data starts in August of last year. And the reason why it starts August of last year is that's because we implemented QRMD in that month, which is our new EHR that gave us the opportunity to start collecting data. So in August of last year, we had 45 appointments. In September, it was down a little bit to 30. And I ran that report twice. So I'm still trying to figure out why that was down a little bit. October back up to 75, November 71. December we were down, and the reason for that is listed underneath that chart. Our nurse practitioner was out. So for that program, we have to have a nurse practitioner present to be able to provide primary care. January 68, February 70, and March 71. So we're running right around the 70 mark, month to month for those visits. On the next page, you'll see our community clinics. So October kind of overshadowed all the other months for our community clinics. And I think I explained a little bit in a previous meeting that October is when we're out there providing a lot of flu shots in the schools and the community. So that's why that number looks like that for the month of October. For community clinic appointment types, the biggest one we're providing is single immunizations. We're doing some multi-immunizations, some PPDs. The wellness checks, the data in QMD was pulling a different way in the past. So we started coding it different. So that's why those wellness checks look low. So as we move forward, that will start looking a little different. Questions about the report, about any of the programs or the data?
So the wellness check is because it just weren't being recorded.
So a lot of times when we were going out into community clinics in the past and providing blood pressure checks, in our previous system, it wasn't mobile, right? It was server based and we couldn't readily bring that out into the community. So we were doing it, we were recording it, but it wasn't going into our EHR system in the same way.
Right.
So as we're moving forward, that will change.
Okay.
Okay.
Any other questions? Thank you. I do have, Ms. Palmer, I do have one suggestion and ask that in the future, any of these type of slides that we go ahead and get this up on the monitor up here for anybody in the audience that like to see this, so they can also see it, not just here, because most of us are more visual learners than we are auditory. So I apologize that so we'll move forward. I'm sorry, go ahead, ma'am.
Jackie Brown. Honest.
So you have your Aspen report in your board packet. And I do want to add a couple of additional items that recently came about. The Jefferson County Health Department was awarded funding from the Jefferson County Mental Health Board Fund Board of $43,745 to support Aspen and a mental health awareness and education campaign through December 31st of 2023. I've been participating in the First Responder Missouri Behavioral Health Committee as a request of the State Fire Marshal and other county and statewide first responders. So this has been a very exciting opportunity. I have also been asked to participate in the Missouri Children's Mental Health Collaborative meetings in Jefferson City, and that'll be starting next week. And one that just came about last week, Jefferson County Health Department has been asked to participate in an opportunity through SAMHSA called the Governor's Challenge to prevent suicide and participate in the development of a suicide mortality review committee in Jefferson County and throughout the state of Missouri. This will include working locally with partners, including the Child Fatality Board, Department of Mental Health and Senior Services, Department of Health and Senior Services, and the Department of Mental Health and other county partners. I will be facilitating the Missouri team, and JCHD will be a pivotal part of the Missouri group, and we will be part of a national planning session in New York this year. This is an invitation-only opportunity where 9 others and myself will be going to New York and working with others throughout the country to review suicide mortality boards and working to implement them in Missouri. So we are honored and excited to participate in this opportunity. And it is paid for through SAMHSA and the U.S. Department of Veterans Affairs. Any questions on the report and the announcements?
I will say one thing, two things. Congratulations or condolences on that work, because it'll be a lot of work. I think, congratulations for all the hard work, and I think you're getting due recognition for that program. So
Thank you. We're very excited.
is there any other questions?
Yes.
So, Miss Trustee Davis.
The grant you just received for 43,000 was from
That was from the Jefferson County Community Mental Health Fund Board. And that
And that's
is,
the letters for that is JC.
the acronym, I believe, is JCCMHFB.
Page. Okay.
Trustee Deal,
Glad you got the.
trustee Deal, thank you.
So if folks don't know, for years, the county and probably a lot of other places have had a child fatality review board, which I always thought was an excellent way to make sure that nothing untoward was happening to children. So now there's going to be a
Suicide.
and
It's a suicide, I don't want to say it wrong, Suicide Mortality Review Committee. And we were asked to pilot this in the whole state of Missouri, and I was asked to facilitate that pilot group. So it's a really exciting opportunity. They chose a few states throughout the country. So we get to go to New York and work with others in West Hampshire and Veterans Affairs and really look at what the child fatality boards are doing throughout the country and how we can utilize some of those processes to have a suicide mortality, to look at data and then utilize that data to implement more preventative and proactive methods throughout the state.
right, exactly. Okay, great.
Yeah,
Thank
thank
you.
you. Thank you. Thank you.
Thank you, Jeremy.
Thank you.
I would like to make one comment on that. You know, I've unfortunately been in a profession as well as Mr. Workman, where you do see a lot of this. And, you know, I had to look a mother one time in the eye when her teenage son had committed suicide. And it was the most horrible thing I've ever had to do in my life. And if this program saves one, I don't care if it's $1.5 million, $2 million program, if it saves one, it's well worth it. So I apologize for commenting on that, but it's much different when it's an accident than this. All right, next, I'm sorry, continue. I apologize.
Brianne, would you?
Thanks.
Thunder away, I apologize.
That's okay. Okay, so I'll be brief then, because as Mr. Pitt said, he totally did take my thunder, but that's good. So just a few things to go over as far as like agency communications, the communications and marketing, help me, report is in your packet, Lord have mercy. But a few things I just kind of wanted to highlight so that we all have that, brush up on our procedures and whatnot. The communications email that is listed there is the inbox that's used for all of our public communications to the agency or to the Board of Trustees. So if an individual wants to contact JCHD by email, they can email us at communications@jeffcohealth.org. That comes to the public communications officer, which is me. And then I'll respond to that within 28 to 48 business hours based on what it is. So if someone just has a question, that's something that I can answer. That's part of my job. If it's something specific for a certain employee or program and I need, that extra support, I'll forward it on to them. And then if it's anything that's addressed to the board, that gets forwarded to all 5 board members. If an individual, I just said this, but if you do want to contact a board member, email that same inbox, communications@jeffcohealth, put attention board in your email subject line somewhere where we can see that. And then, like I said, that gets forwarded on as well within 24 to 48 business hours. Our custodian of records is COR@jeffcohealth.org. That inbox is used for all of our records requests. So if you're requesting any kind of agency records or anything like that, you can email COR@jeffcohealth. If you do end up just emailing it to communications, I'll send you an email that says, we've got your email, I've forwarded it to COR. In the future, this is the email inbox to get it to drop directly. And our website, just a reminder for folks who, want to hang out on our website. We have lots of great information on all of our services, our programs, our contact information, upcoming events and classes. Highly recommend that. The health ed department just had a whole list of class offerings for the summertime, spring, summer. So definitely recommend checking out that section as well. Plus, you can also request certain programs like our car seats, Pledge of Lifesaver, etc. on the website. And then I did want to say I have been working on redesigning the website. It is a labor of love. It did take a minute, but one of the pieces I did do is design a page just for the board pieces, because all of the board stuff was kind of getting messed up on, or mismatched in the opening page. So if you go into our website, under the About Us, you will see one that says JCHD Board of Trustees. So in that is where y'all's information is. That's where we'll have the program board reports, so the electronic copies of what you guys get there. And then we also have all of the approved board meeting minutes. So I just want to make sure that that information was out there. And then there's also the button that you can click to contact them if you need to. And then, as always, everything is always available on the mobile app. So if you haven't, encourage folks to download that. Or if you're out and about in the community, people have questions, tell them to go to the app. It's the best thing to get in touch with us and to kind of get an overview of what we do. Were there any questions for me?
On the Google Analytics, it's the 35.8% is red, but it doesn't state what that page is. That's the most visited.
That is one of the, I can pull it up on my phone. Yeah. Oh, that's the homepage. Sorry, that's that main page. So yeah, because it doesn't have anything after the, like a / it's our main page. Yeah. Good question. So yeah, so it's when they land in there.
Thank you.
Any other questions? Thank you. Just so everybody knows, I have tasked Ms. Vollmer and Ms. Weiner with looking into potentially getting somebody to come in and help us augment that website, to help you augment that website to make it better, to improve the communication throughout it, to update it, improve it, so we can get more information on there, as we really should be getting on that area. Right now, it's a little clogged, like you said. We need to work on it. We're going to, because that's one of my pet peeves, is get that information out. So I appreciate that. Thank you.
It does look like the app's doing well, huh?
Yes, the app is. I have a goal by the end of the year, so everybody find 10 friends and get them to download it.
Director Vollmer.
The next item on the agenda is to recognize, we had 2 staff members who received awards at the Missouri Environmental Health Association annual conference this past month. Beginning this month. But I would like to take the opportunity to publicly read their recommendations that gave them their awards, because I think it's important for us to know some of the great work that our staff are doing. And I think it was really interesting that the 2 awards that were received, one was for Rookie of the Year, so somebody right at the very beginning of their career, and one was for a Lifetime Achievement Award. So the first one was Rookie of the Year for Victoria Bowen. Tori is an EPHS, Environmental Public Health Sanitarian, 1 at the Jefferson County Health Department. She has been with the department for 1 year. Tori quickly learned her job and was out doing food service inspections on her own in less than 4 months. In that short amount of time, Tori completed the curriculum requirements for the National Retail Food Regulatory Program Standards. That requirement includes 29 prerequisite courses, 27 post-curriculum courses, and 50 inspections. Since that time, she has completed the requirements necessary to conduct childcare inspections and has become a certified ServSafe instructor and proctor. Tori is hardworking, consistent, helpful, communicates well with the public, and is always ready for a good laugh. Hence, she acquired the nickname Bubbles. She is a ray of sunshine for her coworkers, and we are very fortunate to have her as part of our environmental team at Jefferson County Health Department. The second award went to Mr. Steve Sykes he received the MIHA Lifetime Achievement Award. Steve was an integral part of the COVID-19 pandemic public health response, in which he held multiple positions. As part of the Public Health Emergency Operations Coordination, he was the safety officer. He worked night and weekend shifts, conducting case investigations and contact tracing so other staff could take time off. In addition, Steve assisted the preparedness planner in visiting potential sites for vaccine point of distribution, clinics, creating efficient flow charts for stations within the pod, and working with JCHD staff and Missouri National Guard units to develop safety plans and logistics for traffic control. Steve was a pod manager at the clinics, as well as worked on the planning team to improve procedures and train new staff. In 2021, Steve was promoted to Deputy Director of Agency Operations at JCHD. He oversees all agency operations, including IT, facility operations, community services, health education, environmental services, and public health preparedness. As part of agency administration, he influences the agency's overall mission, yet continues to impact the environmental health program on a daily basis. Steve served as a board member of Missouri Milk, Food, and Environmental Health Association from 2006 through 2010. He is an active board member of the Missouri Board of Certification for Environmental Health Professionals and served as chairman of the board from 2019 through 2020. Steve was on the board of certification for Missouri Environmental Health Association, and I'm going to get this one wrong, it's Missouri Milk Food. There's a full MFFEHA. When those two organizations merged, he assisted with updating the board procedures and helped to review and update questions for the certification test. In these board positions, he has continuously positively impacted MIHA and the Missouri environmental public health community for over 16 years. His skills and knowledge aside, Steve also demonstrates a great sense of humor, which can bring levity whenever it's needed. He is team-oriented and brings this approach to the entire agency. He has excellent conflict resolution skills and can handle most situations confidently and professionally. His commitment, expertise, and character strengthen our team, the health department, and the people we serve. For these reasons, JCHD would like to nominate Steve Sykes for the Lifetime Achievement.
Thank you very much. All righty, our next duty is to go into closed session, and this is specifically and only related to the next section below. And number one, discussing approving the director's salary, review of the evaluation in a closed session. So that is the only thing that's being discussed in that closed session. And that'll be 610.021, hiring, firing, disciplining, or promoting a particular employee or employees by a public governmental body when personnel information about the employees discussed or recorded. It's also going to be section 3, records which are protected from disclosure by law. I'll make that motion. Do I have a second?
I'll second.
Thank you. Any discussion on this motion? All right, not hearing any, all in favor? Oh, excuse me, I need roll call. Thank you. Almost.
Mr. Pig,
Yes.
Mr. Deal,
Yes.
Ms. Stone,
Here.
Dr. Henry,
Yes.
Ms. Davis.
Yes.
Oh, yes.
All right. Sorry, folks, but we will go into closed section. I don't think it's going to be real